like you said, mental health, which is our topic today, is big at Baylor College of Medicine. It is big at Harris Health, where I work also. It is big to my heart. So
Yes.
we all the time try to continue to expand what we can do in terms of mental health for the community. And when I say mental health, I always think about mental health for people who have no insurance, meaning the uninsured and the underinsured population, because this is one of those
Absolutely.
illnesses which, even if you had insurance, a lot of time you end up losing it because of the disease process. So you have to think about people who are
And it can
uninsured
be a
and
lengthy process too.
uninsured also. You just cannot think about people only who have money or who have insurance. So
Exactly. Because unfortunately, mental health isn't, it doesn't matter about your color, your
yeah,
religion, it does not
yeah.
matter, your age, doesn't matter where you live,
Exactly.
it affects us
And
all.
studies show over one third, close to half of mental health issues start as a teenager. So you start early, and if you don't diagnose and start treating, it becomes a problem. So there are numerous things like that, which is an issue for our community.
Absolutely. And with our organization, Advocates of Healthy Minds, and that's advocatesofhealthyminds.org, if you'd like to look at our website, the classes we teach, we start actually in elementary school.
Yeah.
Sadly, we have children that, first graders and second graders that have anxiety and depression in our world today.
Yeah.
And it's, like you said, the sooner you can start, the
The
better.
sooner the better.
And we give classes to schools, and that would include the counselors, teachers, the children, and so on. And we've also been being asked to give classes to the parents also.
Yeah.
'Cause
Yeah,
it's,
because you're right. Especially when you think about kids, anybody less than 18, you have to involve the parents. Because a lot of time parent may not understand what's going on. If they understand, they don't know how to deal with it. So it's a two-way thing that you have to involve parents and the person, meaning the patient. So both need to be involved, and the teachers.
right,
So
absolutely. So everybody can work together. It's
yes,
very important. And of course, if, as adults, we don't necessarily say, okay, once we have children, we don't have
right.
depression or anxiety or whatever. And so you have a parent that has depression and anxiety and a child too. And
Yeah,
it's tough
yeah.
for
The
everyone.
biggest issue with mental health is stigma. And I've always said, and I'll say it again, even the word mental health has a stigma in it because you use the word
Absolutely.
mental. Whenever you use the word mental, stigma comes. So if we can decrease, get rid of stigma a little bit even in today's program, I think we have achieved a lot because stigma is something we need to get rid of. Unless and until we get rid of stigma, people are not going to come forward with their problems, with their
Absolutely.
issues, and talk to a doctor. So we need to make a combined effort to get rid of stigma, decrease the stigma, so that people talk about it. Like they say, it's okay to say, it's okay to talk. So you have to talk about it. Unless and until you talk and seek help, nothing can change.
I agree, and you absolutely have to talk about it. We have to talk about it to each other,
Right.
and so that way we can help each other.
Correct.
And that's from experience myself. There's some things that I've gone through in my life, and when I was able to share what I was going through,
Sure.
then I'm serious. I did not meet one person that did not say I have an aunt and uncle or myself
Yeah,
or
yeah.
I've had depression. What are you doing, Evelyn? That type of thing.
When there is a disease which affects over 20 million people, which is depression, you will see somebody who has it. There is, anxiety is common, depression is common. There's so many illnesses which are common, and these are all mental health illnesses. If you are a primary care doctor, primary care physician, over 40% of your patients do have some mental health issues. Why not talk about it? Why not treat it? Why not get help?
Absolutely, because I have people that will tell me about their knee surgery or their open heart surgery in detail, but I don't want to talk about mental health,
Yeah.
and that is wrong. We've got to have it in the same
Agreed.
same
Exactly.
same area as
Yeah,
that.
because it says, actually, it's more important because if you look at stats, if you look at studies, any illness will get treated better if you are mentally sound. Example, if you have a bypass surgery and you're depressed, it's going to take a long while to heal. But if you're not depressed, motivated, it will be healed quickly. So they are
Absolutely.
linked. And that is the reason every disease, your willpower can be more if you're not depressed, if you're more stable.
Because our whole body works together.
Yeah.
And which is very important. But like you said, if one part's not working, and,
Yeah.
and our brain is just as important as the rest of our body.
Yeah, yeah, exactly. So we have to do something about it. So, but people don't think about it. Sadly, that's the issue.
Right,
Yeah.
right. And yes, we absolutely have to get it out there. And I know you've been doing this for years
Sure,
and
sure.
advocating, and so have I. And I think now we're hearing a little bit more about it.
Yes,
Thank goodness.
we are. The thing is that we hear about mental illness more so when, God forbid, something bad happens in the community, whether it is a mass shooting or something like that. And people start thinking that everybody who's doing all these bad things may have a mental illness. That's not true. Only less than 5% of mental health patients have tendencies towards violence. So it's a very minor number. And second, as soon as that is over, everybody drops the ball on mental health. We need to continue talking about it. We need to continue doing things about mental health, meaning awareness, meaning education, meaning trying to get health and easy access to people who suffer.
Right. I agree totally. And I know with our organization, what we're trying to do is we start at younger elementary school ages on it. And the whole point would be to recognize that particular child that may become, unfortunately, become a shooter when they're older. Or get them the coping skills. And obviously, any of these young people that have shot other people, unfortunately, they've been dealing with a lot of stuff themselves for a long time, and we're trying to reach those.
Simple things like bullying, simple things like those can be treated, and that helps a lot.
Right, and the other thing that I've really been looking, good point with bullying, because I know the one thing that we're trying to look at also is why is that bullier bullying?
What had happened to them that they became like that?
Exactly, because there's something going on at home or somewhere. Something's
or maybe
affected
they were
them.
the victim of bullying in the past. Who knows?
And so they repeat it. Exactly. So there's so many areas we need to examine. And like you said, then there's bullying. But okay, let's find out why is that person bullying? And we need to get them help also. And going back to the stigma, the first thing that you'll see on our website is our Sheriff, Troy Nels, who is in Fort Bend County. And the first thing you'll see that's on our website is him saying, step up and speak up and stop the
Yeah,
stigma.
and actually I was reading the paper today. He was on the front page of Sugarland paper saying mental health is a number one issue for the county, which is important. And I'm so happy to see the officials, people like Sheriff and others talk about mental health because it's so important, and I'm so glad that they're recognizing it.
Yes.
So that's very important because when people in power recognize it, things can change.
Yes, absolutely. And plus, they have a venue where they can get more information out. Like I said, the
Agreed.
front page of the paper.
Exactly.
Everyone will see that.
Right.
Yeah, and so that's important also.
Sure.
And one thing we have, and if any of you viewers would like to do this, starting November 15th, we are having a Santa suit challenge.
Okay.
And what that means is you challenge each other to wear a Santa suit to work for the day. And those of you that do not accept the challenge will need to donate $50 to our organization, which we have a website and a very secure PayPal that you can use and so on. But with the holidays coming, the reason we're bringing that out is there's a lot of issues that happen with people during the holidays. But again, we thought with a Santa suit that people will pay attention that, yes, we have to step up and stop. But what each person wearing the Santa suit will be saying, which we will bring a camera to you at your job. And what they'll be saying is step up, speak up, and stop the stigma.
We have a young girl who
Okay.
actually sent a message
Okay.
on Twitter asking, where does mental health care come from? Like, what's the big thing? And she keeps hearing a lot about it, but she says, where did it come from?
Can you repeat the question
Mental
again?
health
Mental
care.
health. Yeah,
Care.
like mental health. Since such a big thing now going
Yeah.
on, like you just said,
Yeah,
in the
right.
news and Sugarland, the person just said, where did this come from? Hasn't been there, I guess, all the time. Or is it
So, yeah, mental health has been there, obviously, just like any other part of the health, has been there forever. But with a lot of things happening lately, the focus is more on mental health, as you know, like things like whether there is a attack on somebody or there is a crime which may involve somebody who later they find out that had some issues with their psychiatric health. So we talk about that more. And it's good to talk about mental health because if you talk about it, you educate about it, that's when you can get treatment. But yes, the light is more on mental health lately in the last 5 to 10 years as opposed to before. People were suffering from diseases like schizophrenia, bipolar depression, anxiety for forever. But yes, the focus has been there more now, which is the same as there's more focus on diseases like diabetes, high blood pressure, asthma today than they were 20, 30 years ago. So we are catching up, which I'm very glad that we are catching up because if you catch up, you can treat it. So I think the answer to our listener is that because of so many things happening, there's more focus, more awareness. A lot of time we have awareness campaigns to teach about mental illnesses, and I think that's where this all is coming.
Gotcha. Because I know when we do our classes, the first thing I ask is who has mental health? You say, raise your hand. Do you have mental health? And of course, everyone kind of looks around the room and say, ooh, do I put my hand up or not? And of course, everyone has mental health.
Correct.
It's whether it's positive or negative, or you may be going through some kind of issue. And so that is
Simple
our goal,
thing.
is to help people
Simple
get
thing
help.
is stress. People think that stress is bad or good.
Right.
And a little bit of stress is normal. If you have a little bit of stress, that's a motivator for you to do things. So a little bit of stress is a good motivator for you to function. But if your stress becomes beyond manageable, then it can cause problems like depression, like anxiety, like others. So things in moderation can be okay, but when things become overboard, they are not okay. So, but we need to have some understanding of that. So.
Right, and then and along, like you said, there's a difference between stress and maybe generalized anxiety disorder and so on. And that's why if you feel like you're going through anything, it's like we talked about, whether you have insurance or you don't.
Talk to somebody, talk to your friend, go and see a professional counselor, therapist, psychiatrist, psychologist. Talk to somebody. It is okay to talk, don't ignore it. Just like if you have headache, you will go and see somebody. Just like if you have high sugar and you find out, you'll go and see somebody. This is just like that. You need to see somebody.
I absolutely agree. And with our organization, we have a class that we're doing. It's called Reboot Recovery. And we just started doing that. I did research for a couple of years with this company that gives it. But it's with our veterans, first responders, and so on.
Good.
And I know so many, it doesn't matter if you're a veteran or a first responder, just our general public, that so many people don't want to say, oh, gosh, I'm dealing with something, or I'm feeling depressed.
Yeah.
And so on. So I totally agree with you. It's just get help, and it's okay. Like
Yeah,
you said, if I had my sore throat, I would definitely go to my doctor
Yes,
because I can't
yes.
miss that.
Because
before.
I think the difference
Right.
there, and you raise a very good point, the difference there is that if you have a sore throat, you're physically suffering. Or if you have a pain, if you have a headache, you're physically suffering. And people get help with physical suffering because it's easy to tell people, oh, I'm suffering that much. I cannot breathe or I cannot swallow anything or so. Mental health is not a physical suffering, it's an emotional suffering. So you cannot gauge it that easily. And that is the reason some people don't go. Although emotional sufferings are more severe than physical sufferings because they hurt your soul. But people don't think of it in that way. And they will only go for a physical suffering because it's seen. So if you have a cut, you know that there's blood and you know how much
Right,
blood you're
exactly.
losing. So you will go and see a doctor. With your emotional issues like mental health issues, you don't know how much blood, meaning not the blood, but emotional scar
Exactly,
you
right,
have, and you
right.
may not go and see somebody. So
Right.
that's a difference usually.
And I know so many people have asked me, well, is depression and the different mental things that are going on out there, is that really a chemical imbalance in your brain?
So let's just talk about depression since you start with depression. So if you think about it, depression is a very common illness.
It definitely
About
is.
20 million, 17 to 22 million by some estimates are affected by depression. And while it's very common, so many of people who have depression, over 1/3, don't get any treatment. Do not get any treatment.
And why do you think that is?
So there are numerous reasons. First of all, a lot of people think a little bit of depression is normal, may or may not be, and I'll tell you what is normal, what is not normal in a second. And a lot of people are not aware that what they have is depression. They may think of it as anxiety or something else. So let's just start with what is depression. So depression is sadness, depressed mood, losing interest in activity, and that should last more than 2 weeks. It can be less than 2 weeks if somebody is suicidal. Otherwise, if you have lost interest in things, you're depressed and sad, and that is lasting 2 weeks or more, that means that you have clinical depression or called major depression. Now, the other thing to qualify for this diagnosis is that these symptoms are causing some functional impairment. Meaning, if you're at work,
Right.
your work performance is bad. If you're at home, your relationship is bad. If you're at school or college, that process is suffering. So we call it depression when you lose interest in things, when you're depressed, sad, maybe even crying, and it lasts 2 weeks and your functioning is impaired. So that's one thing to know. Now, a lot of time people may have sadness for 3 days
Right.
or 4 days. That's not enough to qualify for clinical depression or major depression. Other symptoms with depression can be increased appetite, increased sleep, lack of concentration, focusing, suicidal thoughts. That all are there. But interest is the key, sadness is the key, and the time period and functional impairments are the key. So if you're sad on a Monday morning, it's okay because it's Monday morning,
right,
but you
right,
will be
right,
fine by Monday afternoon. If you're happy on
Right,
Friday
yeah.
evening, that's okay too. So I mean, a little bit of sadness is normal. Right, so that's what the definition of depression is. Other thing which happens is that what do you do with depression? If somebody has clinical depression, major depression, they need to get help. They can have therapy, cognitive behavior therapy, but they can also have medication therapy. And what is important about medication therapy is that you don't stop your medicines. You see a
Right.
professional,
A lot of
you
people do
take
that.
medicines, and you take until you are told to do so. Because if you stop them in the middle or take it intermittently, you can have withdrawal symptoms which are not fun, which are not good. So please use a better judgment, talk to the prescriber before you do anything like that. And depression co-occurs with anxiety. So 2/3 of the people who have depression have generalized anxiety. 2/3 of the people with generalized anxiety have depression. So try to use the medicines which are good for both because there's a lot of overlap here. Generalized anxiety basically is present in about close to 30-40 million people more than depression. This is something in which people worry about things a lot. They worry all the time. They worry a lot and they are focused on the theme that what is going to happen, what is going to happen, what. So in other words, depression is a past oriented disease because you
Because
focus
you're
on the
worried
past.
about what happened in your past, and
Yes.
you're worried about what's going to happen in the future.
So in depression, you focus on the past. So guilt, guilt, which is a symptom of depression. You focus on the past. In anxiety, you focus on future. What if? What if? What if? And that what if causes you to worry about everything. Definition of generalized anxiety is that if you're having these symptoms for more than 6 months, more days than not,
Okay.
not maybe every day, but more days than not, more than 6 months, and again causing functional impairment. For us, in order to diagnose anything, we need functional impairment, meaning the symptoms are severe enough that a person is not able to function well at wherever they are, at work or home
you said,
or
it
school or
affects your whole
college.
life. It can,
Exactly.
yes.
So please remember those things. It's very, very common. And then social anxiety is common too. We are in Houston. We had a Astros match with
Right.
with Yankees, and
Right.
social anxiety came in play. Why? Because one of the player had social anxiety, and he declared that. Thank God he didn't have stigma with it, but people started
Right.
making fun of it. That's not good either. Social anxiety is extremely common. It's the second most common cause of anxiety after generalized anxiety. And if somebody is coming forward, I think it's a good thing that celebrities,
Yes,
people
yes,
come
I-
forward and
I
talk about
applaud
it.
him and thank him for
Exactly,
doing that.
because he will give
Yeah.
hope to other people that if they have social anxiety, they can be as successful as he
Right,
is.
right.
So it's very good.
Doesn't
So we should
matter if
salute
you're a
him. We should applaud
superstar,
him.
a
Absolutely.
Pitcher, a regular person like myself or whatever.
Absolutely.
It affects everybody.
Absolutely. So that is the reason we need to encourage those people to come out. And social anxiety is basically anxiety in social places,
Settings, right.
in social settings, and people think that their anxiety is that they may be a failure. Everybody's watching them. People are going to neglect them. People are not going to like them. So they have a sense of failure around people, and that's also very common.
And I know that affects, like you said, teens and
Yes,
high school and
yes.
college and
Yeah,
and
games,
all of that.
everything.
And I think a lot of times too, people medicate themselves, and it could be alcohol or drugs or whatever, which of course makes it much worse even.
It makes it worse.
You know, it's better
And
to go get that help instead of saying,
drugs
well, hey, I'm
and
gonna
substances are
treat it
extremely
myself.
common everywhere. Houston is not new to it. Alcohol is very common. Marijuana is very common. Still, people come and say marijuana is legal. It's not in Texas. And the problem with that is that you don't know what you're getting, and it may be mixed with, or laced with something else. So that's an issue. Then you have synthetic marijuana, which is Kush. That's another big issue, because that can cause as bad psychosis as a schizophrenic psychosis.
And it's even cough syrups and things like
Yes,
that our young people are
yes.
trying.
And Houston
and
is
it's
also
not good.
big on cocaine, which is very
Yes.
addicting. So there are a lot of substances which you need to be aware and be careful about.
Absolutely, and there are organizations out there that
Yes.
will
Although I
help
have
you
to-
out whether you have insurance
Although
or
I have to
not.
say that the treatment for substance abuse is not as well available in this county as it should be. We need to have much more available. We are working on it, but we need to have much more available because we have things available, but when you have a substance user and they go for treatment and they're told that they have to wait a week or two, you think they're going to come back?
Right.
Not necessarily. So you need to have more things available. That's extremely important.
Yes, no, I agree, and it's like I said, important to do that. And like you said, that once someone's on whether drugs or alcohol or whatever, it's very difficult to stop.
Yeah.
And so you need to get that help right
You
away.
need to get some help right away because maybe that is the time, that is the turning point that if they get help, they will take it. But if down the road they're given help, maybe they're not ready because they unfortunately go back to the same peers, to the same crowd, and they start using again. So
And that influence with each other just
Yes.
it just expounds it.
Correct.
tremendously. Well, I know with the holidays coming around the corner, of course, there's a lot of people that do have depression, anxiety, and even more so, I think, with
Yeah,
Thanksgiving and
holiday
Christmas.
blues are very common, and holiday blues can be numerous things. So, for example, a lot of time these days, people get together with their family and friends, kids or so, during holidays, Christmas, New Year,
Right,
and they look
right.
forward the whole year to get together with their
Exactly.
kids and family and all of that. On the flip side, you will get some family members around this time which you don't want to see. Maybe your
That's true
in-laws or so
too.
forth, and that causes a different kind of stress,
That's
but that's
true.
different. But let's just talk about
Yes.
the blues first.
That's a
which-
whole different topic,
Yes.
right?
Let's just talk about the blues first, in which you're looking forward to see somebody, and then you find out that they may or may not be coming. That's going to cause depression. Or they're not coming this year, they will come next year. Or if they come, you don't have finances to greet them, buy them gifts and all. That happens. All those things
And
happen.
that's stressful.
That is very
Makes you feel
stressful.
embarrassed and
Or you want to
bad,
go and
and
see
yeah.
your mother or father, and you don't have money to do that. So all those things are stressful because it is considered more a norm that people will get together. So all I advise people is that if you see your neighbor, if you see your friend who's alone during Christmas, Thanksgiving, please invite them for lunch, for supper, so that at least they have somebody. They are also our family because you see them. So don't just let them be
Right.
alone. At least involve them.
Yeah.
But holiday blues are very common, happens every year, and the causes can be missing your loved ones,
Right.
financial stressors, and then the other kind of blues are when you have unwanted guests
Yeah,
who are coming.
exactly.
And the way to prepare for
Yeah.
them is that you need to know that only coming for a few days, hopefully.
Right, yeah, that's right.
And,
That's right. Not more than 3 days.
not-
You know
yeah,
that old saying.
hopefully,
Not more than 3
and
days.
they're coming because they are maybe linked to your spouse or something. That's the reason they're coming. And if you
Right.
can handle them for 3 days, then hopefully the rest of the year it's okay. So you have to just try to accept it as is. But sometimes it is tough. Avoid during holidays. Few other things to always think about. Avoid having conversations which can cause rift, tension,
Right.
and disagreement. So what are those? There are three examples. One is religion. Don't talk about religion. Whatever your beliefs are, the other person may or may not believe. A lot of
Exactly.
people these days, youngsters, have less belief in religion. So be careful talking about that. Second is politics. Our political arena is
politics.
so
Ooh.
polarized that
Yes.
you're going to lose your good friend. Don't do that.
I
Whatever they
actually
believe
know
is,
actually
do
have
that.
know people and have a family member that lost a friend
Yeah.
that's been friends. They've been friends for 20 years over
Exactly.
during the elections with the
So
president.
religion, politics, and the last thing which people miss is money. Whoever has money, not money, whatever way they spend, that's their choice. Don't talk about it. So if you avoid these three main issues, usually you can handle it, and there is less conflict. If you remember
I
that.
know
So-
just one suggestion. I know with our family, we do a drawing to pick who is your person you give a present to.
Yeah.
So that way you don't have to buy 20 presents, just
correct.
one.
Yeah.
You know, so that's a suggestion because
People,
not
a lot of
everyone
people
is
are
in a
doing that.
financial.
A lot of people are doing that because that's easy and that's well, and they even have a limit that the present
The
would be
amount,
20 bucks,
yeah.
50
Right,
bucks, 25
right.
bucks, whatever it is, so that everybody's. Otherwise, there is a competition that oh, I need to do more than what the other person is doing. So you need to have a limit, and that happens in workplaces also and all, and that is very helpful.
Yeah, and it works very well actually. And that
Yes.
way you're showing that fondness, that care, that love, and you're
Exactly.
exchanging gifts during the holiday, but it's not extremely expensive on one person or another.
Correct.
And,
Agreed. Fully agreed.
yeah, and I think your point was well taken too, for sure. Please, if you know someone that's going to be alone during the holidays,
Don't let them
please
be alone.
invite
That's the
them
whole
over.
sense of
Yeah.
the holidays, that you should sense of holidays not to eat turkey at your home alone when you
no,
know your neighbor is
exactly.
not having anything, or just enjoy your Christmas when you know your neighbor. Maybe buy a small gift for them, involve them, and that's the reason we have a big feast on in Convention Center on Thanksgiving Day, so that people who don't have a home can go there, volunteer.
And have a meal. right,
Exactly.
Because it's Thanksgiving is all about
Not
being
only
thankful.
a meal, not only a
Right.
meal, but
And the
interaction with
camaraderie,
people.
right.
Exactly. So that is very important, and we all need to be involved in these kind
Which
of
a
things.
lot of times they don't have
Correct.
any other time. And so it's good that we
I
can
mean,
do that.
we should do it as often as possible, but if we do it a few times a year, that's the least minimum, bare minimum, right?
Yes.
So we should do
I
that.
agree. Absolutely. And sadly, I know during the holidays, a lot of times, unfortunately, people consider taking their lives, by suicide and that type
So,
of thing. And
If you think about it, suicide is very common. It's the second leading cause of death between the ages of 15. Now they say up to 34.
Yes. The highest it's ever been in our
Right,
history.
right. And every
Unfortunately.
12 minutes there is a suicide in this country.
And we still have 20 veterans
Yeah.
taking their lives every day.
About 44,000 people commit suicide each year. We also need to focus on about the 250,000 people who survive suicide. So while
Right,
40 plus
right.
thousand commit suicide, there's so many people who survive. And the number one risk factor for future suicide is previous suicide. So if you know somebody who survived trying to hurt themselves, get them help, because unfortunately they may try to do it again and they may
Right.
succeed. So very, very important. Now your question about holidays and suicide is usually the highest around May and usually around October or so, which is pending dooming, like, thinking that nobody's going to be with me during holidays and all of that. But it's an everyday phenomenon. We cannot
Yes.
ignore that.
Yes.
Anybody who has suicidal ideations, tendencies, please make sure they don't have firearms. That's the most lethal kind people can use. Make sure they express their feelings, see a therapist, see a psychiatrist, see a psychologist. So those are very, very important. Suicide is a
Get that
serious,
help.
yes, it's a very
Get it. You've
serious
gotta
issue.
get it.
If you
Yes,
have
it
depression, bipolar disorder, 15-20% of those people commit suicide. If you have schizophrenia, 10% of those commit suicide. If you have personality disorder, over 10%, maybe 15% commit suicide.
And that
Very,
goes
very
back
important.
to what you're saying too about continue to take your medication. I know different people that have bipolar or whatever, and they
Yeah.
said, "Well, I feel so much better, so I'm going to
And
quit
that's
taking it."
that's what they forget, that they are better because of the medicine.
yes,
So if you're
yes,
better because of the
yes.
medicine, you stop it. People don't stop high blood pressure medicine. People
No,
don't
of
stop
course
diabetes
not.
medicine.
Right,
Why
right.
medicine for psychiatric issues?
Yes, I agree.
But they do that.
And it's, well, I feel so much better, so I don't need it. And,
Yes.
and like you said, and I get so frustrated because it's like, well, duh, the reason you feel better
It's because
is
of the
because
medicine,
the
but they stop it.
Yes,
Yeah.
yes, I
Yeah.
agree.
People don't
Definitely.
think about it. So
Right,
yeah.
right.
And that's the
Exactly.
reason family, caregiver, friends can convince them. Mr. So and so, Miss So and so, you are better because of this. Don't stop it. Because the provider, the physician, the doctor is not there with them 24/7. They don't know.
Exactly. No.
It's the family who knows. It's the caregiver. It's the
And they
friends who
see
know.
the signs, or
They
see
see
the
the warning
changes in
signs.
the person, or
Yes,
whatever.
and if you think about the warning signs of depression are losing interest in things, complete loss of interest in things, isolating yourself, withdrawing yourself.
Yeah, not wanting to be with friends, like you
Right,
said.
right.
Yeah.
And the warning signs of bipolar are talking too much too fast, increased energy, and not sleeping. So I say that if somebody is manic or bipolar and they don't sleep for 3-4 days in a row,
Right.
and they have lots of energy without sleeping, get some help. Because if I don't sleep one day, I'm
Oh,
tired.
yeah, me
right?
too,
So
yeah.
if somebody is not
Absolutely.
sleeping,
And as humans, you cannot
exactly,
do that.
2-3 days in a row, and they're not
Right.
tired and talking too much, please get help. Because if you are able to save one person with mental illness, I think you can sleep much better than not.
Oh, I agree, and I actually teach suicide prevention classes. That's
very good.
And so if anyone needs me to come and speak to a group, and have had knock on wood, have had very good luck with that.
Very
I think a lot of people just really need to be in a group where they can actually say, guess what, I've thought about taking my
There are
life.
crisis intervention hotlines they can call, 1-800-273-TALK.
Right, right. And you can
those
text.
are, yeah, you
Because
can
you can
text,
even
you can
text
talk to
now,
them,
people will
and
talk
they will ascertain whether you need to see somebody or not. So there is help available for that. Don't think there is no help available. There is help available. If you don't have insurance, there's still help available. You can go to places which will take you without insurance. So that's not a barrier. The only barrier is yourself.
Yes.
You have to get out and go. People are not going to come and get you. And if you cannot go, it is the responsibility of your loved ones, of your friends, of your family to take you
Yes.
and get you help. Because guess what? When you start feeling better, we hope that you will come on your own. Until then, maybe somebody would have to push you, not physically, but take you.
Right, right. Because when you feel depressed, you don't want to get out of bed, you don't want to leave the house, you don't want to do anything. And so, and also when you're going through that, you're not able to handle everything yourself. So you
Correct.
do need a loved one, a friend, or someone to say,
Yes.
I see what's happening here, and let me help you.
Correct.
And be there
And
for
help
that
is
person.
available. So
Yes. And another thing I teach when I do the suicide prevention classes is that it's okay to ask someone,
Yeah.
are you considering taking your life?
yeah, actually, studies show that asking people about suicide does not increase the likelihood of suicide.
It's actually the opposite, I
It
found.
exactly, and when you ask, people will discuss because it's people think. Oh, I think the reason people don't ask, even a lot of physicians, is they don't know what to do with it.
Right.
So
That's true.
if you're scared that if somebody tells me that they want to hurt themselves, what are they going to do? And you can get help. You can take them to a
Yes.
counselor, to a crisis center, their walk-in clinic. So you can do a lot of things. But if you know what to do, you're more likely to ask. If you don't know what to
Yes.
do, you are not going to
That's
ask.
true, because
So
then
that's
you would
important.
have, here's a solution, or a way we can help you.
Exactly.
Right, exactly. And I know I have actually not, do not take your life contract as such. And so when
me,
you're at a spot
Yeah,
where
to
it's
me, the
really
contracts
serious.
are not that important. Why? Because the problem with contracts is that anybody can sign it,
Right, and not mean it.
not mean it. So it's much better to involve the family and the
Oh,
friend
absolutely. That's your
and say
first
that
avenue.
you are the one who will be with them, take care of them, take firearms away, take other sharp objects away, take the medicines away, so that they have less means of hurting themselves.
And guns, like you said.
Right, and if you see that they are going down or so, you will bring them to the doctor, you will do something. Another thing I always say is if you're feeling sad, depressed, don't stay alone. Being alone and empty minded is a cause of problem. Go out, see somebody, go to friends, go to even a mall and be busy. Because when you're busy and with around people, more than likely you won't do anything. All these things happen when you're alone by yourself.
Right, and I found too, a lot of people that I've worked with, that volunteering or helping other people, a lot of times is so
Sense of
helpful.
accomplishment, sense of
Right.
accomplishment,
'Cause
sense
you
of
have to
pride.
feel like I'm worth something,
Sense
I'm
of
doing
pride.
something good.
Yes, and remember, self-esteem is already low in these people.
Exactly.
If they can do something to improve their self-esteem by volunteering, by helping others, it's a huge achievement for
I
them.
think a lot of times too, when you volunteer, there's so many situations out there, whether it's health issues or whatever, that you think, gosh, my world's pretty good.
Yeah,
And you
yeah.
see what
I'm better
other
than a lot of
people are
others.
dealing with.
So, yeah,
Right,
sure,
right.
sure.
Well, going back to the contract for just a second, the way it's worded is really good. And I was in a situation where it was really late at night. You would have to physically have taken them to get help, that type of thing. And so I said, would you agree to, you will not take your life tonight? And that did, but you have to see, like you said, whether is that person at that spot or not, where you can really trust them.
Sure,
And you're right, because sometimes they can sign anything and say, sure, just I want you out of my
And the other
face.
problem with,
Yeah.
with the contract is that in the court of law, it's not
Right.
held
Yeah,
right.
it's
So you
not.
just have to be.
It's not not that kind of contract. It's in that just will you agree with me tonight? It's really more of a mentally, emotional thing. That can you be okay tonight? Because I've dealt with men and that type of thing, and of course I can't stay there really, and
Sure.
and I just want to make sure, will you be okay till morning? And we've got an appointment at 9:00 to get you in or whatever. Yeah. So I agree. With our teens and our college students, and sadly there's a lot of
Lot of
people that
things
take their lives by suicide too. I think we kind of know a lot of that, but what do you think causes that? I know it's stress.
So the most common thing you see in teenagers and young adults is pressure. In today's age, a lot of them are not able to handle the pressure which we, the parents or the peers or others, put on them. Example, a lot of parents want their kids to excel in education. A lot of minority, it happens a lot that they want the child to be a physician or an engineer or whatever, and the child may or may not be able to do it. You're putting unnecessary pressure at the child, which means they may not be able to handle it. When they cannot handle, there is sense of failure. When there is sense of failure, then comes suicidal ideations, depression. Other thing is relationship. They are in a relationship with somebody, he or she or he, and peers or parents may not approve of that relationship, or that person who you have a relationship is breaking up. They cannot necessarily handle that breakup, and that causes depression, suicidal ideation, and they try to hurt themselves. Why? Because remember, teenagers, even in their 20s, early 20s, they're very impulsive.
Right.
And that impulsivity, suicidality is an act of impulsivity also. So when you're impulsive, you feel immediately sad and depressed, and you immediately feel that life is not worth living, whether it is because of a breakup or because of excessive pressure, because of education. You think about hurting yourself and you do it because you're impulsive, as opposed to hopefully a mature adult who's in the 40s or 50s who has less impulsivity. Some may, but less than the younger. So that
True.
causes
Right.
that a lot more. So we need to be very careful in putting pressure into somebody if they cannot handle it. In terms of relationship, we also need to be careful. Intense relationship cause more issues. Less intense relationship cause less issues. Relationships are fine, but it needs to be hopefully less intense, because not everybody can handle intense relationship. Intensity in relationship is an issue which can cause depression
Right.
and the suicidality and all
Well, you're
those
right,
things.
and
Yeah.
it's sad that, and again, it's well, maybe I'm not good enough, or
Yeah.
if the
Causes
person
low
broke
self-esteem.
up with you
Yeah,
or whatever,
yeah.
or
And
it
you
goes back
find
to
them going somebody
self-esteem.
else. Exactly.
Yeah,
So
exactly,
it's
and the
very important.
jealousy that they're seeing someone else now, and it's all a
But the
mix.
but the positive side is that can change pretty quickly in some young people as soon as they find a new
Oh, yeah,
relationship. So
absolutely.
it changes too.
It's like
So it changes very quickly, and we should focus
Yeah.
on the positive as opposed to negative. But if you try to maintain less intensity, hopefully you can handle it.
That's a good idea.
Yeah.
And to just have that in your head when you're going to college or even in
Yes.
high school or
Correct.
whatever. So, right, I agree. And I think too, what I've heard, different people say before too is it's just like, well, this is the end of the world. I was planning to get married and we were going to live happily ever after. But like you said, if it's not as intense, and so many young people that I have worked, dealt with and talked to and worked with and helped, is that this is just a part of your life.
Yeah.
If it's like high school or college or whatever, I mean, I dated several different people before I found my husband, and you look at that and it's just that time of life you're going through, and don't end it here when you have so much more
Agreed.
ahead. It's
Agreed.
just
Fully
now.
agreed. Fully
just look
agreed.
at it as a very short time in your life
Yeah.
that, I have met with families that, and sadly, that their children have taken their lives.
Yeah. Yeah.
And again, I just want to stress to all of you out there, on whatever age you are, this is just a short time in your life compared
So
to the rest
ask
of your
about
life.
those. Know your kids. You need to know what's going on in their mind, in their head. Know them. See if they're withdrawn. See if they're isolated. See if they're try to have a outlook that they're using drugs or not. Try to know that they're stressed because of what reason. Try to help them. So communication is important. Talk to them. You can be the friend, but you need to talk to them. If you don't talk, who's going to talk?
Absolutely, and I know a lot of mothers and fathers I've spoken to. It's just they say, "Well, my child won't talk to me." So what do you suggest then? They don't want to share. It's like leave me alone.
Kids always talk to the parents, but when you say that they don't talk to the parents or they're not going to talk to the parent, you have to give some of that responsibility to the parent. So when they grow up, if the parents talk to them without judging them, they're more than likely to talk to the parent. But if the parents start putting
Absolutely.
unnecessary pressure and judge them, they're not going to talk to you. So it is a two-way street, and the parent have more in this two-way street than the child. So don't judge your kids. Be a listener. They are looking for a listener, not necessarily advise
point.
every
You're right.
minute and every second. They hate advices, but just be a
Because they
listener.
know everything right now in their
In
life,
their
or
mind,
they think
in their
do.
mind, they know
That's right.
everything. They may or they may not, and some
Right.
things they know more than us.
Yeah,
because they're
that's
young.
true. Especially technology.
Technology, exactly.
For me.
Exactly. So we cannot completely discredit that they don't know, but I would suggest that listen to them, validate them, have empathy towards them, not sympathy, but empathy towards them. And if you listen to them and do all those things, they will talk to you, they will confide in you. The moment you start judging them, the moment you start only advising them, you have lost them. Now, once in a while, you will advise them, and that's okay. But if you advise them all the time, they're not going to talk to you because you are another.
Because they bring up a topic and say, well, here's what you should have done, or here's what you should be doing, and that's not
Those
what
things
they
can be
wanna
said in
hear.
different
They
ways
want to
too.
share,
Yes,
right? And it's all
they
the way you
want
word it.
they want to talk to you as a friend if you will let them. So just be careful on that.
Gotcha. I know, of course, a lot of people are talking about, why is this happening? Of course, the word social media comes up big time. And I know one young lady I was talking to, what her concern was that she had seen, I think on, of course my age, we use Facebook more now than, but she had seen that there was a sleepover with her girlfriends, in high school, and she wasn't invited, and she thought those were her friends, and so that's
it
stressful.
happens. That's stressful. That decreases your self-esteem. You start thinking, what people don't like me? Am I bad? Am I not doing anything right? Am I not in the right crowd? That's another issue with kids these days is that they like to hang out with the right crowd.
Right.
What is a right
Yeah,
crowd?
what is that?
Right crowd can be really a right crowd as far as you're concerned, or for them it could be the cool crowd who is cool, but maybe using stuff and this and that. So you just have to be very, very careful.
And that's very, very tough because, like you said, it's low. You want to be liked. You want to be.
Yeah.
That's all part of it. A young woman I was talking to the other day is actually a junior in high school, and she said she just recently left this particular group because she herself saw it wasn't healthy for her.
I know.
And
But
I'm so
that
proud of
happens
her,
very
but that's
rarely. But
hard.
I'm really proud of her. But it
Yeah,
happens rarely
yeah,
because people get into that trap. So,
Mm-hmm.
truly, in all summary, what I will try to suggest is, if you know somebody who is suffering from depression, who is suffering from anxiety, who is suffering from any psychiatric issue, mental health issue, get them help. Get them help,
Absolutely.
take them to see somebody. They need to see somebody and get help. Talk to somebody. It's okay to talk, it's okay to say. Don't just ignore it. Maybe they have nothing, but if they have something and you get them help, you will feel so proud of yourself. So that's the most important thing I will suggest.
Right. Well, I got a call from a friend of mine the other day, and there was a young woman. It was actually through Young Life, and she needed some help, so I was able to refer them to a counselor.
Yeah,
and
it's important.
boy, she's doing so much better now.
Yeah,
And I
yeah.
was concerned when I heard the story of what was happening with her, that because she was pregnant and the boyfriend was a gang member and things like that, and so there's so much out there, and so she's left all of that now, and she's
That's
getting
good.
the help she needs.
That's
and,
very good.
And doing so much better now. She wants to actually help and work with Young Life to help other
Yeah,
young women that have
that's
been
very
through what
important.
she's been through.
That's very important.
So again, helping each other is such a key.
It is a key. So,
And we absolutely have to do that. I can't stress that enough. So tell me what all, if I didn't even know what Baylor College of Medicine was, what happens at Baylor College of Medicine?
Baylor College of Medicine is a medical college for medical students who come, get admission, and then they try to become a doctor. And on top of that, we have hospitals where we have affiliations. Bentop is one hospital, St. Luke's is another hospital, Menninger Clinic is another. We have affiliations with Texas Children. We have affiliations with a little bit with Methodist. So people go and work in those places. So the goal of Baylor College of Medicine is education, which is to make doctors, teach them, make doctors, research, unique, innovative researches, and whatever we can do for the community. So we do a lot of those things.
Wonderful.
Yeah.
So just do about what % actually go into the psychiatry field? Or
So psychiatry is becoming more and more popular lately. It's very hard to become or get an admission in residency. In the past, it was easier, but it's not anymore. We have about 14 slots each year, and we get about 1,100, 1,200 applications for
my
that, which
gosh.
is not easy to even review. So it is very different than what it used to be, and because there is a need. And these trends change every few years. But right now, psychiatry is very difficult to get in, and Baylor is a very good medical school, very good residency for psychiatry. So people are interested in joining a lot.
Right, and we are so lucky to be in the Houston area to
Yes.
have Baylor College of Medicine, UT, and all the medical hospitals, and MD Anderson, and I'm so thankful to live in this area and grateful that we have all of that. I have several people ask me, what is the difference between a psychiatrist and a psychologist?
Yes, good question. So they both are called doctors, and they both are good in their ways. But the main difference for people is psychiatrists are MD doctors. They go through the residency, they go through first medical school 4 years, then residency 4 years, and then become a psychiatrist. If they do fellowship, it's further. They can prescribe medications, they can do therapy. They don't do psychological testings.
Okay.
Psychologists go through a psychology program, internship, which is a year, then a fellowship, and then they become licensed clinical psychologist. They don't prescribe medications. They can do therapy,
right.
and they do psychological evaluations. So the path is different. One is more towards therapy and psychological evaluation. The other is therapy and medication management. So the difference is medication management versus,
Right.
psychological evaluation. Psychologists do psychological evaluations. Psychiatrists do prescription of medications and management. Rest, they both do therapy and they both understand the illnesses. So that's
Because
different.
I've found that, like you said, and I am a huge advocate of medication. If it helps you, I've had more people say, I don't want to take anything.
I also
and
want to
it
tell
helps
people
you.
that
Yeah.
we need psychologists, and I hope they feel that they need psychiatrists, because remember, in a hospital you cannot do anything without nurses,
Right.
without social workers. Same thing in our field, we cannot do anything without psychologists. So it's a relationship of mutual interest to both, and one cannot do without the other. So we need them, they need us, hopefully, and that's how it works. There's no less than the
Right.
other.
No. And I think, like you said, psychiatrists can prescribe the medication and so on, but psychologists, counselors, and that type of thing can help you
Sure.
maintain
It's a
whatever
team.
you're going
It's a
through.
team.
It's definitely
So-
a team, and it all goes together. I agree. One thing that, how are we on time? I've been so interested in talking.
I think we're almost there.
We're there. Okay, good. So, well, the last thing I'd like to talk about then is one thing I have found, and this is a class I teach, is called mindfulness. And what we were talking about earlier is exactly what you were saying, is that most of us spend our time thinking about, oh gosh, all the regrets from the past, and oh my gosh, what's going to happen too in the future, whether it's tomorrow, next month, or next year, or whatever. And so I've actually had several people tell me that the mindfulness area is so important. And like I said, I teach it to police officers and students and everyone. And so it's so important on a daily basis to look at the moment. What am I doing? Like right now, I'm just concentrating on this totally. I'm not thinking about, okay, this afternoon I have this or this or this or whatever. And so to end, I would like to teach a mindfulness moment. I will make it short because I think we're about out of time, like you said. This hour just went fast. I knew we would have a lot to talk about.
Yeah.
So the mindfulness class I teach is for you to take yourself to wherever you'd like to. It could be to a mountain, it could be to the beach, wherever it is. And so this a lot of times will help people sleep that aren't able to sleep also. And just when you're stressed out or you're in traffic or whatever. And so what I'm going to choose today is the beach, since we live in this wonderful warm climate and we have beaches nearby. So what we're going to do is just relax and sit back in your chair or on the couch or wherever you are. And so, like I said, we're going to the beach. And so I'm imagining I'm taking a friend with me. I usually close my eyes and just relax. And so I've arrived at the beach and I've laid out my towel and my friend has laid out hers. And I hear a seagull going over. And again, just you relax and relax more as you do that. Just very sensitive to everything that's around you. And so this is usually in a very quiet room, that type of thing. So I'm on the beach. And I can see the beautiful sand and the waves lapping up against the ocean, against the shore. I hear a seagull flying over. That's always been a very calming sound to me. And so I'm relaxing, and I have my sunglasses on, I have my towel on the sand, and in the distance I can see a big ship out there. And over to the right, it looks like there's a dock with a small boat that's rocking in the waves. I'm looking at the colors of all the water, the blues and the whites and the waves against the shore, the white part of that. And the whole time I'm just letting my mind relax totally. And I'm not thinking about yesterday. I'm not thinking about tomorrow. Oh, shoot, I forgot to pick up dog food. Oh, no, okay. Bring myself back. If you have to, you can even put a stop sign up in your head. That stop, whatever is going on in my mind, go back to where I am. And so this is something, and just to think about everything, the blue sky, the sunshine, everything around you. And it's a good way to relax. And like I said, when you sleep at night, and I said that was very brief, and we usually do it in a setting where you can do that. And I also teach breathing techniques. And the quick one I'm going to teach right now is 10 deep breaths to the very bottom of your stomach. So way, way down there. And 10, not 2 or 3, and 2 or 3 can help. But when you do that with your body, you can't help but relax, because by the 10th one, you are more relaxed. And, for students, that I teach this with students, if you're about ready to take a test and you're nervous, no one knows you're doing it. So it works very well. So is our time up?
Time is up. Thank you, folks. And
Yes,
hopefully, with today's hour, you will be able to at least get something, which is if you know somebody who need mental health,
Yes.
please get them some help. Talk to them. It's okay to talk. Reduce the stigma. Get some help. Help is available for everybody. Thank you.
Yes, it is. Thank you.
Thank you.
We'll talk to you another time. We'll see you next week. And next week we have Crystal Stewart, who is a former Miss USA. She was Miss Missouri City and then Miss Texas and so on. And she has she's called Miss Academy, which is in the Galleria area. And also Miss Houston, Blaine Ochoa, will be here next week. And they will be talking about being beautiful from the inside out.
Good.
Thank you all. Bye.
Thank you.
Did you guys have fun?
Yeah,
Yes. That was so good.
that's it. Okay. Good.
Okay.